Hello, everyone. We are so excited to have you all joining us today for our first Autism Ready Communities Take Action webinar. I'm Kristen Soule, and I'm a pediatrician at the University of Missouri. I'm also the founder and director of a program called Echo Autism, which is trying to change the world and the way that we think about taking care of people with autism so that we can really work together so that people with autism, no matter whether it's in their doctor's office, their school district, their grocery store, their a restaurant in their area, can really experience what we call autism ready communities. And so part of that is also working together to take action. As you may have noticed, we are in a world changing time. So pandemics obviously don't come around often. And boy, am I glad that that is the case. But certainly it brings to mind all of the things that we need to think about and work together to better understand what's happening and how can we work together to support each other during this unprecedented time. So our team of experts wanted to try to help as many people as we can to think about how do we make a plan, how do we work together? And so that's part of the reason we're hosting this, again, what we call Take Action series that is part of the work that we do. And so again, you heard me say, I'm a pediatrician, so I love taking care of kids. It's the joy of my life. I do specialize in taking care of people with autism from about the age of 12 months all the way into adulthood. And so when we talk about the work that we're doing today, we are going to work on and talk with you about some strategies and some tips about preparing your child to go back to school. Now, the things that we're going to really think about are how to prepare your child to go back to the physical school building. But that does not mean that that is the only choice that is going to be right for you and for your family. We know that this pandemic comes with much uncertainty. And so for that reason, the individual choices that you need to make based on the current statistics in your own area and based on your own individual needs as a family, whether there be elderly living with you, or there may be specific health conditions that your family is working with, or your child's needs are very individual. We will talk more about that during our time together. But we are going to focus today on how can we best prepare you and your child, or you as a professional, to help make the best of this particular situation that we all find ourselves in. And so today, that's what we're going to talk about. We've gotten some great questions that have been sent in by all of you who've registered for this. So because of that, we may not get to open question time, but we promise to answer as many questions as we can. And we'll definitely make this webinar available to those of you who would like to see it after, and also share it with others. So as we get started, I want to make sure that we introduce our fantastic panel of experts that are with us today, and then we'll go ahead and get started with our presentation. So I want to have an opportunity to introduce Dr. Renee Sorensen. She's a clinical psychologist who specializes in the assessment and treatment of children with neurodevelopmental disorders and severe problem behavior. She joined Cincinnati Children's Hospital in the year 2000, and has focused on providing intensive intervention services across multiple settings. She has developed home-based ABA, community consultation to schools and agencies, an intensive severe behavior treatment day program, inpatient psychiatric stabilization for acute crisis management, and currently leads a program for patients admitted for medical care who have pre-existing behavioral challenges or who struggle to tolerate their care for any reason. She received the Richard M. Smith, MD Leadership in Patient Safety Award from the Healthcare Collaborative in 2015, the Envisionary Award for Outstanding Leadership in Developmental Disabilities in 2016, and in 2019, she received the Exemplary Therapist Award from the National Alliance on Mental Illness. She's a dear friend and extreme leader in this space. And what I think you'll hear from her today are practical solutions and ideas that you can use to help support, again, either your child, your loved one, or your student as you're trying to think about the best ways to make a plan. Again, your plan may not include going back into the physical school building. It may simply be making the best plan for going virtual. Whatever that plan may be, we want to provide you with strategies, and Dr. Renee Sorensen is a world leader in this particular area. Our other panelists today also include Dr. Rachel Brown. She's a physician, psychiatrist, a child and adolescent psychiatrist, and chair of psychiatry at the University of Kansas School of Medicine in Wichita. And she has worked with people with autism spectrum disorders for many years, as well as across multiple settings, and is particularly interested in the co-occurrence of autism and other psychiatric illnesses. She's also a dear friend and has been part of our Echo Autism and Autism Ready Communities work for a number of years, since its inception, actually in 2015. You will hear as we talk today about the deep appreciation that we have for taking care of people with autism and their families. We call that whole care for the whole family. And Dr. Rachel Brown really encompasses that as she's worked across her entire career and embodies the mission that we want to create communities that are ready to include people with autism across their lifespan and across those life goals. And so we're thankful that she's part of this today as well. Next up, we have Alicia Curran, who is the mother of a 19-year-old with autism, a son with autism. Following her son's diagnosis of autism, she devoted her professional career to working in the field of autism. And she currently works at the University of Missouri, where she is the Director of Operations for the Echo Autism program. She's also a faculty member for the LEND program, which is a national program funded by the Health Services Research Administration. She's also the program manager and quality improvement lead for the Autism Learning Health Network, which is part of Autism Speaks, as well as another HRSA-related program. She's also the Center for Disease Control's Act Early Ambassador for the state of Missouri and leads numerous initiatives to bring about both the early identification of autism symptoms, but also the great importance around awareness about autism, but more than that, the inclusion and the importance of understanding autism, not just being aware of it, but truly embracing autism and supporting patients, children, adolescents, adults, and their entire families, and the beautiful things that people with autism are capable of doing. Then, last but not least, we have Melinda Odom, who is a licensed clinical social worker and our training manager for the Echo Autism program. She's also a faculty member with the LEND program, which I mentioned before. She's also the self-advocate faculty member at the University of Missouri, meaning that she helps to support self-advocates who are on the autism spectrum and helps support them in learning how to best utilize their voice and helping to maximize their voice as an essential role for us understanding how to work with individuals with autism, as well as helping them to advocate for their needs, and really who better to help us understand how to be maximally inclusive than a person with autism themselves. She also was previously a support coordinator for children and young adults with autism and other developmental disabilities here in the state of Missouri. So we're really excited to be able to share our expertise with you. We each bring multiple different avenues of experience and think that we will hopefully be able to answer many of your questions. A few things to remember. We are definitely all in this together. I think as I reflect on the last, almost 6 months of this, we are all truly in this together. I know that may seem like a phrase that may seem almost cliche at this point, but to be honest, it is nothing but true. We are all trying to figure out the best choices as we navigate this. The science is literally changing every minute of every day. As a physician, I can tell you I keep up with the science. I'm the president of the Missouri chapter of the American Academy of Pediatrics, which is a responsibility I take very seriously. Therefore, that means not only do I take care of people with autism as my professional job, but I also represent 1,200 pediatricians across the state of Missouri. So I keep up on all of the science, and it is a very difficult task because weeding through not only the science, but then all of the other things that are coming out is challenging. So we are in this together and know that it's changing rapidly. And so we understand how difficult that is to make sense of all the things that are happening. We don't have all of the answers, and we won't have all of the answers, but we will do our very best to help you think about the strategies that can support the person that you love as they prepare to go back to whatever learning environment makes the most sense for them. So again, that means there are no right or wrong answers in a pandemic. And unfortunately, that is something we all will have to continue to learn how to get comfortable with. So there aren't any right or wrong answers about sending your child back to school. This is a deeply personal issue, and each family has to make a decision based on their own complex situation. We will provide some guidance around how to think about that, but again, it's a very difficult topic. We would encourage you to try to teach your child these strategies, the things that we're going to talk to you about to keep them safe in advance, and to not solely rely on the school to do it for you. We know that the participants on our webinar today may include many teachers and professionals, and so certainly we recognize the exquisite position that you're also in. We know that you're worried about your own health and safety as well, and so we know that we are, again, in this together, and it's incredibly important for us to all be aware of that as we go forward. And so the best outcomes will come from collaboration, support of each other, and information sharing. Educators, school systems, parents, and healthcare providers are struggling to navigate this. I'm pretty sure we all would agree to that. It is imperative that we do our very best to work together and support each other, and we encourage your patience and grace as we go forward together. So a comment about the AAP stance of the American Academy of Pediatrics. I'm sure many of you are familiar with that. We do know that for the total health and well-being of children, it is best for them to be in a physical learning environment. That's where they can grow and thrive socially, emotionally, and academically. However, the caveats are so many. And so we'll talk about many of those, especially during our question and answer time. But I think that when you look at the global health and well-being of any child, that's where that stance comes from. And so of course I could go on and on and on about the nuances of, but what about this and what about that? And that's what it's impossible to address each of those things, but I would encourage you to make sure that you're thinking about those for your individual child. And there is no right answer or wrong answer in a pandemic. So certainly we will get to those as we get to the questions. But without further ado, I really want us to have a chance to hear from our expert, Dr. Renee Sorensen, as she walks us through different things that are so important for us to consider. Again, whether we're professionals in the education setting or whether we're parents trying to make the best decision for our children as we go back into school this fall. So I'm going to turn our attention over to Renee. Thank you.
Thank you, Kristen. For setting us up for today. I think hopefully everyone will find a little bit of helpful information out of today, and there's a lot to cover, so kind of bear with us as we pull through this to get to the question and answer section shortly. And my screen is not sharing. Hold on. There it goes. Okay, sorry, a little technical difficulty there. Okay, we're going to review wearing a face mask, which I know is at the forefront of what many people are concerned about, because we know that our children with sensory sensitivities can very much struggle with it. Hand hygiene is something we've taught forever, correct? But it needs to be a little bit more in depth at this point. Social distancing is something that comes easy for some children and very hard for others. So we'll talk about some ideas for that, as well as how to prepare for school, given that kids have been out of school for so many months. At least in the United States. And we know we have global partners here today on this webinar. Parent-teacher collaboration is going to be key, so that some tips for communication, and then helping you think through a plan for how to navigate the next few months as we put our toe back in the school system. Some key things to think about as we begin is, again, how long our children have been out of school. We know that when kids are off school just for a few months in the summer, that actually can create challenges for going back to school. And now we've actually had kids in virtual learning since March in the United States. So that adds an additional challenge. Some have not received their summer programming at all. Others have received a small amount of summer programming. So there's a lot of kind of renewing of information, new routines to get back into, a lot of new expectations coming down the pike. So for those of you planning to have your children return to school, we know right now that just going to the grocery store has added changes in routine. So I can't even, it's hard to think about how many different things might change in a school system. So we want to think about all those practices right down to what we know with many children with autism is they like their routine. And so when it is changed, it can be challenging. So we're doing the added component of walking back into the classroom, but then even those practices that have been in their schools for years may look very different. So the cafeterias are often Some of them we know are changing to a grab and go type of a situation. So they're not going to have the more formal lines. We don't know, maybe pizza will be available every day and maybe it will not. So think about all of those things you count on for your child that kind of makes their day at school. And you'll need to find out if those things are going to stay or if those will also be something that they will have to navigate for change. So lots to consider here. We don't have a formula for this. This is really about a lot of ideas and idea sharing to help each of you try to put in place practices that will help you navigate. And I wish we could give you black and white answers, but we unfortunately, again, are looking more at things to consider and ideas to help each family navigate what might be a little bit of a different approach, because we also know school districts are doing very different approaches. So some are going back full, some are going back a few days a week. Others might be in a virtual situation if the virus is in a high rate in their areas. So we're trying to kind of think about preparing for all of these different considerations. The other thing is that your child may be returning to their teacher that they had last year, and they may actually be transitioning buildings or going to full new classrooms or having full new teachers. So that is yet another thing to consider when you think about your child going back to school. So all of these different areas will kind of play individually for each and every family that has to face moving back into the school building. The first thing we want to talk about is mask wearing. So our encouragement is that masks actually provide us some of the best protection we have against the virus. And so it is, there's a lot being said about my child should be exempted from this or can be exempted, and that may be the case, but we encourage you, exempted or not initially, to continue to teach your children to tolerate mask wearing because it provides them some protection. So some key issues with this is just, for one, finding a comfortable mask. I have worn numerous types of masks through the last several months, partially because I work in a hospital. So in the hospital, we wear surgical grade masks. But when we're in the community, we don't have to wear those and we can wear a variety. And I know from having my kids that, you know, they fit differently, they fit different faces differently. They're, the different materials feel better on the skin, you know, to one person versus the other. So I have 2 children and they don't like the same types of masks. So it's really important to keep working to find a comfortable mask that they like, and then to have multiple versions of those so that you can have the ability to clean them frequently. Think about reinforcers, right? Identify a reinforcer. It's important to start pairing that mask wearing with reinforcement. For kids who are food motivated, the reinforcer might not be a food because you can't eat while you're wearing a mask, or you can, but you have to shove it underneath and that creates other issues. So thinking about when they like to go to a special place, if they like to go buy something at the store, if they like to go for a ride in the car, with your family, you may not need to wear a mask. They will need to wear a mask if they ride the bus. So thinking about pairing the mask with some of those fun things and just starting really, really small and then gradually increasing that time and putting it under the parent control. So we don't want to start too much because that can create an aversion. So we want to start as small as that child can tolerate and gradually move it on. We do have several resources we will provide you, and there are a couple of videotapes about even teaching how to wear a mask as well. So you can look for more information to come. When we want to teach to take the mask on and off correctly, and that's mostly just by using your loopholes or if it's a tie to stay away from the face. So again, washing hands before and taking it off, which we'll run through really quickly just so you're aware, because even in our hospital setting, we went through mask etiquette. How do you wear a mask appropriately? So it's important things for people to learn. Is it going to make or break it? It's not going to be perfect, but it is important to try to keep moving towards those appropriate skills. And then also, what do you do with your mask when it's removed? Making sure that kids know where to put them, and so they're not being run on the floor and picking up additional germs that they're then going to actually put back on their face. Okay. There are all sorts of teaching tools we can use: social stories, videos, modeling, and practice. Remember, you are the biggest model as a parent or as an adult caregiver in their life. So you wearing the mask and showing that you can tolerate it will help your child feel comfortable and move forward when they are doing it. If you are struggling to tolerate it, they're going to probably pick up on that. Remember, they do watch us even when they don't look like they are. Some problem solving around this. Do they understand what it's for? So we want to continue to teach this message and show them what it's about. There's many social stories out there now, so you can find the one that works for your family. And again, we're going to give several resources for that. Do they see it modeled? Is it comfortable? How long is it comfortable? What kind of breaks do they need to become more comfortable? Some kids run hot, some kids run cold. That might be a change in how they tolerate it. Does it hurt them? Is it hurt behind the ears? Is it causing skin irritation? Those are factors that we have to address. We want to make sure they're as comfortable as possible. And do they just need a break? So I like to teach kids to request a break or to do breaks proactively versus have them have behavior to get a break, because we don't want to teach them that the behavior gets them a break. And that's the psychologist in me. And then sometimes when we do really good, we go too big. So going from, if you have your child wearing it for 5 minutes a day and then they're going to go to school all day, that's probably too big of an expectation. So thinking about these weeks before school, ramping that up gradually so that you can build more tolerance and let your school team know about where you are with that practice. And then always remember your reinforcer. So these are harder things to learn to do. We as adults can do it because we might be reinforced by staying healthy. A child may not feel that's a reinforcer. So again, we might have to use more tangible means to get them to understand. A quick view of taking in masks on and off. So first we teach tolerance and then we work on the hygiene of it, but thinking about having them wash their hands or use hand sanitizer and then putting it over their nose and mouth and securing it against their face and putting it behind the ears. And then removing it, again, just using the strings and not pulling it from the mouth is the biggest thing. And if they can just fold it and place it in the appropriate place, it's helpful. And again, have enough of those so that you can wash them when they're the cloth coverings to make sure that they stay clean. I think for most, it's helpful to have a clean one every day. You don't have to put them in a washing machine. They can be hand washed as well. So washing and drying, hang to dry. And then trying to make sure that once you remove it, that you wash your hands again before you get into your face and spread those germs. So mask comfort, just a few ideas. Reducing the temperature of the room can be very helpful to making masks more comfortable. Think about winter when we don't mind things over our face when it's cold. It's not going to snow in the rooms, but still keeping that temperature down to keep us comfortable is helpful. When we're wearing these for long periods, any of us have been in the hospital wearing them long periods of time, we can notice that we will get some irritation around the nose bridge, sometimes behind the ears. Again, proper fitting is helpful. Moisturizer can be helpful for some folks. Again, everybody's a little bit different, but making sure that faces are washed every day so that we're getting rid of that irritation that might develop. You can consider zinc oxide or Aquaphor, and again, consult your physician. Your pediatricians about things you might do if you are getting friction from the mask. If it's too bad, you might just need a different kind of mask, but really, we don't want any kids to have skin breakdown from these. Glasses, for any of you who wear glasses, which I wear at times, they definitely can fog up the glasses, which is highly annoying. So if you have kids in glasses all the time, the big thing is to make sure that this nose bridge is fitted really close to the face. And if you need a little pocket of air to let air escape, let it be lower. That is the key kind of component. So if you wear glasses, the masks that have a fitted nose bridge are the most helpful. And you can slide them up pretty good sometimes and work out a place that they sit right with your glasses to make it work. If you have homemade masks, you can actually improvise and stick a pipe cleaner in there or twist tie. If you Google this too, you will find a whole bunch of additional ideas. I've seen people fold Kleenexes and just put them in there to kind of mask it a little bit. So there's some simple things that you can do. And then there's the washing the glasses with soapy water and allowing them to air dry or just dry with a soft cloth. That soap provides a little bit of a film that helps prevent the fogging. Those of you who used to be swimmers, you can spit in your goggles. Don't recommend that during a pandemic. I'm just going to say that. Use the soap. Working on finding a comfortable fit, people have come up with all sorts of wonderful ideas to help address sore ears, and also thinking of those kids who might have hearing aids. So think about things that get them off the ears if they already have a hearing aid device. The little clips that go behind the back of the head often can be 3D printed. So I think some of the schools have actually 3D printed them in their own printers or have students do that periodically, and they're just available. You can also purchase them, and they're typically pretty cheap. And then the headbands, you can actually just sew buttons on. So you can take the current headbands kids like and sew the buttons on, just match them to the level of the ears so that they pull right off the ears, and those can be helpful. Tiebacks are often helpful also for getting off hearing aids, or some kids just like them better. Some people pre-tie them so they can just slip them on and off and they don't actually untie them each time. And then there's the other face coverings as well that are more like a neck sleeve. So with a lot of work, some children still have trouble tolerating masks, and we know that that will occur. I just encourage you not to not try. If we have seen many children tolerate masks when their parents are super surprised that they were able to do that. So please do work on it. Your child may really surprise you. The CDC does not recommend the use of face shields in the replacement of a mask. However, they may provide some protection when a child either cannot tolerate a mask or needs frequent breaks from a mask. So in a sense, a little bit better than nothing. They really do need to be approved by your school district. In the hospitals, we use them, and we use them in addition to masks and goggles at times, especially when we're doing COVID testing with children. So they provide an extra layer over a mask and goggles, and I would encourage school teachers to also think of this for children who have issues with behaviors that involve spit or bodily substances maybe coming at you, or at times when you're doing feeding and other things that the child will need to have the mask off. So there's a lot of good uses, I think, for face shields in the classroom during this pandemic. So thinking about those will be helpful. They do need to be disinfected after each use. And then another consideration is there are completely clear masks that can be purchased, or these masks that where the little windows have been put in, and there's various places to purchase them. I actually put the place where I took this picture from to give them credit for that, but it is, you can find these in many places. This little mouth shield is great for the caregivers or adults or teachers of children who read lips. So children may benefit from this too, but really this is more about the adults and caregivers and providers whose kids need to see their face, their expressions, to help with this communication. So remember that a regular face mask will impact your sound quality, overall volume of your speech. It'll make children whose articulation is poor harder to hear. So for some of those kids, it may be better that they wear a mask with a window as well, so that you can read their lips. So all of these things are important to communication, but not every child needs a teacher to wear a mask with a shield, and not every child needs to have one of these. And they might not need it all day, but it's important to think about the times where they do need it. And if a child needs it, this is a huge helpful. I love the creativity of all the people who have developed these kind of things to help us get through this. So consider that a tool. Additional strategies to support communication. Remember that we have to speak differently, adjusting your volume and the rate of speech. So sometimes we have to slow down and we have to speak louder so that they can hear. Repeating instructions and directions, and then ask questions or do something to gauge understanding depending on your student, making sure that they actually heard what you said. If you have to remove your mask to communicate, again, consider backing up, making a little bit more distance, or using a face shield if that's necessary. I think a lot about speech therapists and their need to be able to see faces, and that reliance on looking at the way people communicate. For kids who can, substitute with written communication, or not substitute, enhance it. So add written communication, add pictures, augment your communication to help them understand. And then again, the picture exchange communication systems, speech generating devices, choice boards, etc., all are tools that we always use to enhance communication. We might need to expand these a little bit more across a wider population of students to help with communications during this time where we're mask wearing so much. So do consider those for all of your students, even in the past if they haven't needed them, just if we need different ways to augment communication. Hand washing. We taught it before, we must teach it again. One of the things that I think it is, I really learned how poorly I'd taught my children hand washing when I had to travel across the country in June with my daughter. And we obviously stopped a few times to go to the bathroom, and I was in the bathroom with her, appalled at her hand washing skills. So she learned very quickly, and by the time we arrived at our destination 10 hours later, she was a she was like a surgeon. She was able to wash her hands. But again, all children need retaught how to wash their hands in the pandemic. And I had coached her with this, but truly hadn't seen it all the way into action until we took that trip together. So also thinking about when they wash their hands. So we want to increase frequency of hand washing. When they arrive home from school, I would have them wash their hands from that bus, or even just from being in the car. My kids, when they arrive in my car, get hand sanitizer. Boom, you get in my car, you get hand sanitizer. I don't care where you've been, you are hand sanitizing. So trying to keep these routines and build these new routines. So making sure it's done before food prep, before and after meals, when you're cleaning any surfaces, when they are seen touching their face or mouth or nose, or they scratch their nose, go ahead and have them use some hand sanitizer or hand washing. After the restroom, obviously, and think about shared items. So using them prior to sharing items, and again after sharing items, so that we're trying to keep, that helps keep the items clean, and then it helps just from the spread of those germs. Again, reteaching hand washing skills to make sure they have it, and then focusing on that at least 20 seconds of time. And I really do encourage a song, an auditory cue of some kind to help them gauge how long it takes to do that, because it's easy for kids to get into soap, rinse, boom, and they're done in about 3 seconds. And that's probably not going to be effective during this time. Again, hand sanitizer is another situation, but it shouldn't be a replacement for actually soiled hands. And then there are all different types of hand wipes that might also be appropriate, as long as they have the disinfecting component to them. And then teaching them to cough and sneeze into the elbow. Again, we teach this all the time, but it might actually be needing to frequently practice this situation, especially for kids who are not consistently wearing masks. So kids who wear masks, that sneeze and cough will be better caught in the mask. But for kids who are needing a lot of breaks, really going to have to kind of just put that back into the routine of working on, if we cough, how do we do it? And getting them to get that motor memory down so that they're able to use it when they need it. Social distancing, no easy way to do this, but really trying to focus on that 6 feet away, 3 to 6. I've seen in some places, but the CDC focuses on 6 feet away. Social stories, again, are held. Why do we have to stay apart from each other? The kids need to understand the why. And you may have to read that social story 100 times or 500 times, and that's okay. Keep reiterating it to them, because kids will learn. And even tell them when you think that they're not capable of understanding, because I really feel that most of our kids understand a lot more than we can give them credit for at times. And then any new environment, reminders. Remember, we want to stand in line and stay on the dots. Whatever the rule is in the school, again, you're going to want to remind those before they walk in. So mom, in the morning, it's helpful to review the rules. Teachers on the way into the classroom, it's helpful, or as they arrive. Simple cues, stickers are great. They're all over the country now. We see stickers and arrows and which way we're supposed to walk. And again, it's helpful to be pointing them out. When we're overwhelmed with too many cues, over time, we learn to ignore them. That's a natural human trait. So again, these will have to be taught and reinforced. If we ignore them or we're not consistent with the teaching, they will become meaningless. They'll just blend in to be part of the environment that nobody will attend to. So again, it's important to teach them and reinforce them. And then again, sharing cues that have worked at home and in other environments with teachers, because teachers are going to they might have 80% of their class do great, and then a few of those kids are on a completely different train in terms of following cues. So parents might have found something that worked, and they should share that with the teacher, because it might be another strategy that can be brought forward. So make sure you're talking. If you get on the internet, you will actually see there are schools across the world who are open. And so sometimes they have really cute ideas for training on social distancing. And this was one from China. So I just linked the article, but the pictures of these kids who built these hats to help them kind of think about how not to knock into each other, and they wore them around the day, was adorable. But these are really nice concrete strategies, and they're fun. So consider these types of things if your students are able to do that, or your kids, to just help teach them how we're kind of stepping back from each other, especially if you have a child who is a little bit of a space invader. They need those visual cues to kind of help learn that, and that's really appropriate. Trying to avoid community supplies might be helpful, because again, washing hands before and after is helpful, but it might just be easier for kids to kind of have their own supplies. And then we do have to think about those kids who have personal sensory items that land all over the place. and really teaching them to collect them and putting them in a specific bucket. I think a lot about kids who need a lot of oral stimulation, and they might be able to have something even under their mask, but you have to be careful with those things. And if they are taking breaks from their mask to use their sensory items, again, it's where do they go between, because these are things that need to be contained, just for the safety of everyone. So it doesn't mean they can't use them. It's just how do we work around that and accommodate it. We're all ready to establish the school routines, and I know I have to do some of this too, so it was good for me. But start working on the bedtime adjustment. I have teenagers who are well off track. So think about doing this at least a couple of weeks in advance and gradually adjusting that bedtime back and start getting them up in the morning earlier and earlier until you've moved into that school routine. If you need more than 2 weeks, take more than 2 weeks, but I would really encourage at least 2 weeks of working, because you're thinking of a gradual work to get them back in that routine. Getting those morning routines reestablished. What will your morning routine look like before school, and start getting it going now, because it'll make it a lot easier once the school routine starts. If they have to wear a mask during a bus ride, which most kids riding a bus will need to, again, practicing that in the car. And even if you just say, we're going to do a morning routine and drive the car to school, that can be helpful for some. For others, it will make them think you're going to drive them to school, and that might not be appropriate. So again, doing your kind of own way to do it, but thinking about, a lot of us have established the practice that you don't have to mask in the car with a family. So masking in the bus might seem like a leap for them, so they'll at least need a social story or some training to prepare them for that. And then working with the school to get as much information as you can regarding the classroom. So any social stories, pictures, or information that they can provide to help you work with your child to prepare them for expectations is super helpful. Also remember, the schools are going to be contacted by all the parents, and so that they may be putting things out standard, they may have things out on their websites, so looking at those to really help. I also encourage you to use, if your child uses a visual schedule at school, whether it's written or a simple icons, trying to do some visual scheduling at home with the same routine, just to do a few activities a day per the schedule, just to get them back in the routine of what a schedule means, and that we're going to follow a schedule and how that looks like. You do not have to schedule your entire day, but think about doing a few things each day to encourage them back into that routine. School collaboration is going to be ginormous. And again, remember, we're all in this together. This is new territory. I have never met a teacher who has taught through a global pandemic like this. So we've all been through high flu rates. We've seen schools have to shut down for a week because everybody's sick, a lot of things. So, the goal in this is to prevent that from having to happen, especially for a long periods of time across the entire school. So try to go in with that collaborative spirit. We know IEPs are impacted by this. We know teaching is impacted by this. We know virtual learning puts a huge impact on this. But again, it is what it is. And so the best thing is to try to work together with the district to try to figure out what's the best options for getting through this with health and collaboration and as much learning as possible. So take advantage of your school district's websites and any opportunities you can get to gather information on practices before the school year. And again, they're going to be learning and be getting new information every day. The rates of COVID right now may be very different than the rates when schools open in August. So that adjusts strategies and things across states. So keep an eye on what's going on in your area. Get organized with your questions to be addressed, remembering that the teachers are going to be talking to so many families and they have to get prepared as well. So trying to be super organized so that you value their time as well as they're trying to navigate this. And then working on those routines at home. Again, if you just rely on the school to do all of this, everybody's going to be a little more, it'll hurt everybody. I guess everybody involved will be more stressed if you wait. So it really is important to just focus on working on these routines the best you can at home. That does not mean your child will tolerate a mask 100% when they go to school. But if you can do things that are learning that you can help pass off to teachers, they'll bring their subset of ideas and keep going with it. So again, really working on that is super helpful. And then you might need to meet early in the year to address any challenges that are having or have additional discussions around how things are going to go. And I think of this especially for kids who are struggling with either being scared of school because of the virus, or kids who are having significant behavior challenges that are really hard to navigate with worried about all this close contact that occurs. And that doesn't mean that they can't go to school. It just means there'll be a lot of discussions around that. So think about organizing your discussions around the physical environment. So if your child really gets hot in mask, you're probably going to want to ask about classroom temperature. What's the bus going to look like? Classroom organization and routines. Are lunch and recess going to be impacted? What will that look like? And part of that's just your knowledge if your child has questions or if your child is going to need social stories around those things to help them cope with changes. And then the school may have some social stories for you, but they are not going to have a social story for every single instant of what's occurring in the day. So they have to be given time to develop some of those things. So you might be able to do some of that for your child as well. And again, anything at home you can do to support is helpful. So if your child has not been successful with your teaching of the mask, again, you'll want to talk about the options as you continue to share. And do remember that it's not just about the exemption, if there can be one. It is about the fact that your child is at more risk without a mask on. So we want to balance those things out, understanding that not all children will successfully wear a mask all day, absolutely. So we want to offer them some protection, and at the same time, balancing with that continued need to keep working on it to see if we can desensitize them to the mask wearing over time so that they are safer and can go all the places where masks are required. If they are wearing a mask but are likely to need breaks, again, asking a little bit about that to maybe answer children's questions or what's going to happen, because maybe your child wears a mask, but they need to work on wearing a shield because that will be needed during mask breaks. So again, getting some of that information to help you choose what you're working on can be very helpful. And then also, schools are going to have to think about what happens when kids refuse to wear masks, because everybody's going to have their day, and we know that. But if we just let them out of it when they're traditionally wearing it, that day can become 3 days a week, and then every week and every month, and can become this situation. So really important to problem solve around why they might start refusing it and get them comfortable in it, and think about reinforcement systems and teaching. So the teaching behind these strategies is giant. And then the IEP and behavior concerns, and we could probably take an entire webinar on this, but just to get you thinking is really where we're at with this first webinar. So thinking of your special considerations for communications, I think that's huge, making sure your child can communicate and be understood with a mask, or if people need to wear the masks with the little visors. And then, or if your child is a speech user but has a lot of articulation issues, which might be muffled further by the mask, do they need augmented systems to help them through that? And those, again, can be practiced at home prior to coming, even if it's as simple as a choice board. But if you're worried about that and you've noticed that, giving the teacher a heads up on that and your speech pathologist so that they can start working on that from the get-go will be helpful. Again, behavior management, initially it's about all the teaching strategies to learn these new routines. And then think about anything that involves hygiene or fluids. So a lot of our kids, again, use these sensory items and chewies, and some spit and sneeze and cough on a regular basis for all sorts of reasons. We have kids who are still learning not to nose pick. We have kids who have reflux and are prone to vomiting. All of those things we'll have to have lots of discussion around how we manage those in their health plans. I had a child with reflux, and she manages it fine now, but if she was 6 years old going into the school with this, we would have been having a lot of discussion around the mask and reflux, and she would potentially need to have another mask backup, there if she gets hers soiled or dirty, and so lots of things to think around those things. And again, they're not impossible to solve, and we can't solve them all with one fell swoop. It is about discussing rates of COVID, different options, what your child's good at, when these things occur, how do we best navigate the situations, and lots and lots of problem solving, and then trying things, and then continuing to fix them if they don't work, or the parts that don't work, with really good open communication. Okay. And then when children have significant problem behavior or tantrums, we do have kids in schools who might require restraints for safety. That involves getting very close to children, or we might have to get in there and block behavior very close to them. Again, you're not going to have social distancing when those are occurring. So thinking about what kind of masking or shields or things that folks are wearing to keep them safe, but also just making sure that we have a lot of the proactive functional behavior assessments going on about these problem behaviors in depth with lots of meetings to try to reduce frustration, to maybe prevent some of this and go slower than we might otherwise do in working through the behavior to do more of a preventative approach, yet continue to work specifically on those strategies. So lots of discussions will occur around these behaviors. And then when I talk about make a plan, this whole webinar is about making a plan, but I also want you to pause and make a plan about the fact that kids going back into school are going to have a lot more exposure than kids hanging out at your home. So for those of you who have been pretty quarantined at home and not going out as much, and then you're going to, so you might go do some little things where you're around people, but the first huge exposure might be going back to school with lots of kids around for long periods of time. So really do think about, if your child is exposed to COVID, how are you going to manage that quarantine at home? How, if you work, can you take off work? How will that impact work? Can you work from home? Are you already working from home? What resources do you have to help? Also think about if your child has symptoms of COVID, so you may not have known of exposure, but they do come down with something. Again, this isn't where it doesn't look too bad, give them a dose of Tylenol, send them off to school for the day. So we really have to be diligent about that. So what are your plans for both managing symptoms at home, making sure that we're not putting that COVID into the school if it potentially is that. And we know that the flu will be around this fall too, right? So this is going to get a little dicey in terms of how we navigate who's got what. But how does your pediatrician or your primary care navigate those concerns? It's really good to get on their websites or ask them and make sure that you know how they would want you to navigate the situation in terms of when they might want you to test. It's hard to have a child symptomatic and try to navigate this with zero knowledge about how it works. And I'll tell you that from experience because my daughter was exposed. So, and she did not end up developing COVID, but I had to navigate that experience. And it was a little bit trying because, it came up like, oh, we think she was exposed. Yep, the person tested positive. And now we're navigating all the situation. And I had looked and had some idea, so that was very helpful. I also work in a hospital, but it was still hard. So just know that it is really important to kind of think about these things. And then I have yet to meet a child who likes a nasal swab. So please know that's normal. However, many of them are not really aware of, how that's going to happen and are a little bit shocked and pull back before they even get really super aware. But I can guarantee you, if they have to have more than one test, they're going to get really smart about it. So really important, again, to think about how your child might tolerate it. Do you need support to have them tested? What might that look like? Cars have been pretty good because you have seat belts. That's really helpful. And a parent can bat some, hold on to some hands and give something to hold or do an iPad and that can work well. How long the car testing will stay around in different locations is very varied. But think about how you might get your child through that test with support and be ready to kind of ask for the help you might need to get them through that, okay? And then we can provide a lot of different resources. There's quite a bit out there now, and much of these websites have multiple resources, so social stories, education, ideas, all sorts of different links. There's webinars going about supporting children and students, videos on teaching mask wearing, and then some just specific social stories. But there's a lot of information out there, and they really do a pretty good job of hitting all sorts of levels of functioning for kids. So I think if you do a little searching, you'll be able to find a lot of what you need to help prepare your child at home. Kristen?
Hello.
We're ready for questions.
I am ready. If you want to unshare your screen, I think we are ready to take some of those incredibly important questions that we have coming in. And so again, thank you, Renee, for really important information that you shared. We will, just for participants to know, like I mentioned, we will definitely be making slides available. Stay tuned for exactly where. We plan to post that on Facebook, so you can find that. If you did not find the information about this webinar on Facebook, don't worry, we will make sure that you have access to the information as well. But let's go ahead and get started on some of those great questions. So we have some important questions coming to us. And so I think one of the things that I find most interesting about this is there's so much conflicting information out there. So this question is going to be coming to Rachel Brown. So remember, she's a child and adolescent psychiatrist, as well as the chair of a department of psychiatry. So this question asks, I don't know who to believe. How do I find the best information to help me navigate this virus? So Rachel, we have about 10 minutes, and so I want to make sure we get to other people's questions as well. But so tell us, what do you think about that question?
Yeah, I'm going to go pretty quickly. I think that the best sites are those that are serviced by research scientists and physicians who spend their time, and other professionals who spend their time really looking at that basic research information and original clinical data and compiling that into guidelines. So big picture, internationally, the World Health Organization, nationally, the Center for Disease Control, the CDC, your state and local public health departments will be phenomenal, and their job is to collate all the information. American Academy of Pediatrics, of course, we've talked a little bit about them. But then when you get down to the individual, what do I do with my child? Then finding that professional who knows you and your family, your pediatrician, your family doc, whatever other healthcare provider you have, the special ed teachers and counselors who know your particular child, and having those in-depth conversations with those individuals about what the right decision is going to be for your family. So the big picture information's out there on the big websites, but when it actually comes down to the details of what does this mean for me, for my child, for my family, then having that conversation with your local professional and really sharing your concerns with them, listening to their answers, and then making a plan going forward from there, I think is the best approach.
Great, thank you, Rachel. So we've also had lots of questions around how do we support a child who might be afraid to go back to school because they're worried they might get sick. And so I certainly, as a pediatrician, I've had kiddos tell me that. And so Renee, this question's for you. How do you help a child who's afraid to go back and get sick?
I think we need to help our adults too. So I think this is really important, but many of our kids with autism will get very fixated on being sick or being infected or germs or et cetera, and it can become a perseverative topic. So I think the first thing is making sure that we are managing our emotions around this pandemic. If we are presenting and having side conversations that they are privy to of us being really worried about what's going to happen and how will we manage our own health care, et cetera, they are going to absorb that and become additionally concerned. The news is full of this, internet sites are full of this. So managing their access to these resources, to news, to internet, et cetera, so that you can kind of give them a clear picture. And then getting on board with your school district to also kind of be communicating the information as clearly as you can, knowing their access to peers and what that's going to look like, what different family members are telling them, kind of try to get a lockdown on some of that information, which is hard. I'm not going to say that's easy, it's hard. And then having those direct conversations, using some of these social stories that tell what stories, not scories, social stories to tell what COVID is and about it. And then all these things that we're doing to protect. So this is why we're wearing masks and hand washing, et cetera. Encouragement that our medical doctors and medical teams are working on ways to treat this and a vaccine so that we can eventually not have to worry so much. So focusing on that positive and the positive things that they can do to keep themselves safe will really help them, I think, navigate it. Some might need cognitive behavior therapy and some additional supports during this time, and that is absolutely appropriate and okay. Make sure you're getting them connected. Even if they can't see somebody, telehealth is available most everywhere across the country still. So there's usually pretty good connections, but hook up with your school educators, your counselors at school as well. Use that team. And sometimes it helps them to talk to their doctor directly, who they might actually feel like is more trustworthy than mom. My children would think that. And make sure that they're also weighing in on that to help guide that anxiety.
Got it. Perfect. All right. Well, thank you. And I think that's a very, very good thing. It's a lot about us moms and dads and teachers really working hard to manage our own stress. I can say for sure I'm pretty stressed. And so working on that is certainly something we can all do to support our kiddos. So great. All right. What about this question is going to come to Melinda. And so thinking about how can we, as professionals, whether that be a service coordinator, a teacher, whatever profession that we are helping support families in that transition related, from transition from home back to school. So what do you think, Melinda, about that? How can we best support families in that transition?
Yeah, I'm really thinking about the need to encourage that two-way communication between families and schools, encouraging collaboration. And I think working cooperatively is going to be vital during these times because it's new to all of us. It's new to families, teachers, and all professionals. So working together rather than against each other. I also want to just throw out there's going to be a group of children and families who have less access and have more barriers. And so for my support coordinator friends out there, really thinking about the families that may not have any of this information yet and reaching out to them and making sure they understand the changes in the school rules. Make sure they understand that there are some decisions that families need to make that they may not even be aware of if they're not following the news or they're not looking at the emails being sent out by schools. So making sure they know about food resources, mental health resources that can be provided through the school. And then also if there are any rules or decisions that they need to be making as a parent. I have 10 more, but we have limited time, so.
Okay. I'm sensing we may need to do a follow-up webinar to this great webinar. And so certainly that is not out of the question. So we will see how this continues to go. So, all right, thinking about Alicia. So Alicia, you're a parent of a young man with autism, and I know that you have tons of experiences to share with us. So, one of the things that I've heard from my patients and as well as from community members is what about mandating masks? And how does that work? And so can schools that are mandating masks legally require an autistic or a person with autism to wear a mask in order to attend school? And what are your thoughts about that?
Yeah, great question. Rules can be broken with exceptions, right? So, for parents that, can go to their physician and ask for an exception to be written and give to the schools. However, I will say my son, first I'll tell you that my son is very affected with autism and lots of other co-occurring and psychiatric and medical conditions. So certainly, he's one of those tough kids that Renee talked about to educate. And I think that, I would expect that he wears a mask well now, but how is it going to be when he's at school and everything is different? So my expectation, and certainly those families that feel that they need to ask for that exemption, I would encourage you to, if that's your position and how you feel, I would encourage you to still try to wear that mask and encourage that mask because it does keep them safe and others safe. We have kind of done it from the beginning and made lots of opportunities for my Sam to wear his mask, and he does it really well. And again, this is a kid with lots of sensory issues. He has an intellectual disability and many other things. So I think it's kind of back to Melinda said. It's about that family professional partnership. And I know from experiences, lots of experiences, because Sam's in his super senior year of school, that we may not always agree, but the one important thing that I know is they need me and I need them. Because when we work together, no matter if we agree or disagree, that benefits Sam. So I would strongly encourage you to, because this is, you know, the way our life is right now, and our kids need to adapt. So even outside of school, you know, there's a lot of places and mandates and restrictions and put in place and policies and procedures about mask wearing. So given that our life has shifted a little bit, I would definitely encourage families to try to get their kids, and like Renee said, set the example.
Great. Thanks, Alicia. So we're going to round out the webinar time together. We may go over just a few minutes. So if you need to leave, that's just fine. But, you know, I think what Alicia is talking about is the power of collaboration. And I think, you know, we are in a time where I don't know that there are solid answers to those legal questions. I would encourage you to have those conversations with your school district. You can certainly talk to your doctor about exemptions. They may not have all the answers either. I know I've been asked repeatedly for exemptions to be written by patients and their families. And, you know, my kind of standard answer is that, yes, I will support a, if I think that that's appropriate, I will support that. And yet I do encourage those families to keep consistently working with their child to learn how to wear a mask, child or adult, frankly. So those are important things to think about. So again, the legal questions are challenging at this point, but those are things to think about. So the last question is going to go to Rachel, and then I'll have a couple of summarizing points for all of us to be thinking about. So Rachel, the great question came from one of our audience, or one of our participants. How do we go about dealing with uncertainty involved in this decision? And frankly, many other uncertainties in our time right now.
Yeah, I think that's a great question, and it's a really difficult and challenging one. I am a clinician. I continue to see families and kids with and without autism, with psychiatric disorders and anxiety, and I'm seeing a lot of exacerbations of anxiety and worry and concern. And I experience it myself. I gotta say, the world just is not behaving itself the way it needs to behave itself, and it needs to stop and go back to doing it the way it used to do it. And you know, I'm also realistic, and I don't think that's going to happen in any time soon, hopefully in months, but in days, certainly not. So I think the things that we do are the things that we always need to do. There are things that we can do that will help us stay less anxious and more stable. And the kinds of things that I'm thinking about are sticking with our routines, really working to keep our lives and the lives for our children as predictable as we can. Kristen already referred to this a little bit, but we know, and Renee did too, that we know that the more we can provide our children with a safe and predictable environment, even if the world is falling apart around us, then the better they will do. The things that I find helpful and that I work with the people I work with and patients I work with to try and put in place predictable routines. The things that are stress relieving are, we know that exercise helps, we know that daylight helps, we know that good food, good diet helps. Our hobbies that relax us, the use of music, either to participate in or to listen to, is helpful and supportive. And then I think the other big thing that is part of this is to share our experiences with each other and to reach out for support, not to be afraid of saying, you know, I'm not coping really well this week or today or this evening or this morning or whenever, and to be really willing to share our own vulnerabilities, and then having someone there who just acknowledges that that is just really hard, and hopefully you're talking to somebody who's able to empathize with where you're at and will reach out to you in turn. And I think those are the important things. And then just finally, the other thing I would say is not to be afraid to reach out for professional help if things are really become overwhelming and you're really struggling with maintaining life as you would like for it to be.
Thank you, Rachel. I think that's really helpful. And I certainly can attest to the fact that the world is not behaving and it is not helpful. And so we are definitely in this together. So I think the take-home messages from today is that we are definitely all part of this common world, and all of us are trying to figure out the best strategies from our various perspectives. You heard many, many great tips and ideas about how to support those that you love and care about that have additional needs. You know, of course, we're focused on autism, but that doesn't mean it's the only things that can apply. We all need structure in order to thrive in this world. And so the strategies that we talked about can support those that you love that have autism, but other issues that may be going on for them as well. So we would encourage you, if you're a parent, to really think about those ways to set your child up for success. If you're a teacher, be thinking about all of those ways that you can set the parents that you're about to welcome back into your environments up for success, and obviously those children that they so desperately love and care about. Everyone is trying to figure out those answers, and honestly, no one really has them. Everything is coming at us at such a fast pace. We do know that face coverings, otherwise known as masks, are currently one of the most effective strategies at supporting or decreasing the spread of this nasty bug. And the virus is something that we are learning to rapidly deal with. We also know social distancing, so that keeping ourselves away from those that are not a part of our immediate family is also incredibly important. And so hopefully today, the strategies that we talked about, the things that Renee mentioned, and the things that we will make available to you after today's webinar will also be very useful to you as you make these decisions for your family. You know, this is not easy. These pandemics don't come around often, but we know that we in the United States, I know many of you, or some of you are from other places around the world, but speaking about numbers right here in just the United States, we've lost almost 150,000 people. And so that's not something to take lightly. So as you work with your school districts, your families, your family members, be thinking about, how do you want to plan? How are you going to handle these things? This is real. This is not a hoax. This is something that we are all working to figure out how to manage, how to strategize, and how to deal with together. And so lean on those in your communities and in your support circles who can do this and do this with you well. We are definitely working on this together. So we will make ourselves and our resources available so that you can do that with your family. But again, be kind, be gracious to each other, and be gentle as we all are in this together. So we thank you for your time, and we look forward to you joining us again. We will be announcing new webinars that are coming in the coming weeks to support, again, our communities as we take action to really develop autism-ready communities together. So thank you all, and stay safe, stay well, and support each other. Thank you all.